Let's see a quick overview of the corticospinal tract, also called the pyramidal tract. In other words, that's the major motor pathway. These two sections are taken from the brainstem, midbrain to be specific. This is from pons, and the last three are from medulla oblongata. Just a representation of the spinal cord. This is the upper part, which is cervical spinal cord. This is the lower part, which is lumbar. As the name says, the fibers start from the cerebral cortex, from the precentral gyrus to be specific. The neurons are situated here, here, and here. The axons come like this. They all travel through the posterior limb of the internal capsule. Remember that the fibers supplying the head and neck are here. The arms and trunk are somewhere here, and the lower limbs are more medial. In the cross section, the lower part is the anterior aspect, and the top one is the posterior aspect of the cross section. Okay, when the corticospinal tract descends down in the midbrain, it occupies this region, which is called the cerebral peduncle, this place, and it's in the middle 1/3 of the cerebral peduncle. In the other levels of the midbrain also, it's the same story. You can see that it's here. In the pons, yes, the same place, also in the medulla oblongata. That means fairly it's on the anterior aspect of the entire brainstem. That the tract is very compact all the way, whereas in the pons, it kind of breaks down into individual fascicles because of the intervening pontine nuclei and the fibers. But in the medulla, it joins back to a compact bundle. Around 85% of the corticospinal tract fibers which are here will cross to the opposite side in the lower medulla, forming this tract called the lateral corticospinal tract. They will eventually occupy the lateral part of the spinal cord all the way down, and they will innervate the lateral part of your anterior horn cells, from where you will get the lower motor neurons coming out to supply the individual muscles. What happened to the remaining 15% of the fibers from here? They come down as the uncrossed anterior corticospinal tract, obviously in the anterior part of the spinal cord. They supply the anterior horn cells on the medial part of the anterior horn. But interestingly, when they terminate on both sides, like this. They will also give rise to specific neurons, the lower motor ones, which will go and innervate the trunk muscles. Clinical applications: if you get a lesion in the corticospinal tract above the level of decussation, means above the level of crossing over, the symptoms will be on the opposite side of the body. Whereas if you have a lesion in the spinal cord after the decussation, then the symptoms will be on the same side of the body, which can be clearly seen from this picture. However, if you injure the anterior corticospinal tract, it's not a big issue because it's supplying both sides of the body. Similarly, the tract arising from the opposite side will also be supplying both the sides, so there will not be a complete paralysis. There might be some weakness, but it's not a big issue compared to your lateral corticospinal tract.